The background of our study is the challenging of treat in a patient with diffuse B-cell, elderly and frail, with a comprehensive geriatric assessment that we use on the base of the previous comprehensive geriatric assessment assessed by Balducci. And we share the patients on the basis of a 3 scale in fit, unfit, and frail, on the basis, obviously, of the ADL, activity daily life, the instrumental activity daily life, and the comorbidities, and obviously the age. We treat in our protocol the frail patient, the worst category, patient who had lost 2 or more ADL, 3 or more EADL, and has a comorbidities severe. So these patients are really a challenging population because the toxicities of normal treatment is too high for them. We started on the basis of the good profile of safety and efficacy of lenalidomide that we know that has directly action against the tumor cells and as an immunomodulant efficacy and an expansion and block of the vascular endothelial growth factor. We well known that the activity of lenalidomide is increased with the co-administration of rituximab. This is the backbone of our study, our treatment. Our key found in this patient is the overall response rate. We know that the outcome in a frail patient affected by diffuse B-cell lymphoma is really poor, and only 27% of patients is alive after 1 year. This is the first one. We have in our results over the 45% of overall survival at 2 years in the whole population, and over the 60% of progression-free survival in those who respond with the complete or partial response. This is a good result, and this is an advance in this kind of patient. We think that the chemo-free approach in this kind of patients deserve further experimentation and further exploration, because the normal chemotherapy is not available for these patients. So we think that this is the first step for a new philosophy in treatment in this kind of patient. I would like to improve the supportive care in this patient. I think that one fault of our study was not mandatory use of growth factor or other supportive care. I think that in the future, the chemo-free has to be associated with a strong therapy of support.